You may have heard the budget announced the other day included $8.9 billion for a revamp, if you want to call it that, of Quebec's healthcare system, which sounds like an awful lot of money because it is.
It's needed.
But there are some issues here already. And remember, this is only based on a leaked document that Radio-Canada managed to get. We actually have not heard from the Quebec Public Health Director, from Quebec's Health Minister, Christian Dubé, officially announcing this. That's going to come, I think, this coming week. But there are some things in here that were leaked. For example, part of the overhaul of the system would eliminate mandatory overtime for nurses, and it would change the way family doctors are paid. So it would switch to a payment on a per-patient basis as opposed to payment on a per-application basis, I guess, depending on what you're being treated for. Now, for years, I guess, we've heard this CAQ government talk about the fact, and I think Francois Legault stood up and said this every chance he gets, they wanted to clear up that whole idea where there'd be a doctor for everyone in Quebec. There are still, last time I looked, almost 1 million people, over 900,000 Quebecers, still on a waiting list, believe it or not, for a family doctor. I imagine this new revamp is not going to do anything to deal with that because it's apparently trying to take some services away from doctors and appoint them to other people within the sector. Now, that in and of itself might lead you to believe that some doctors do not want to be a part of this anymore, and that's what I thought this story was about until I realized, no, that's not exactly what's going on. Dr. MARC COTRAN is a family physician. He's only Mark, you're 45 years old?
Yes, I'm 45 years old.
And you have decided to basically say goodbye and leave the system, but not for any of the reasons I just mentioned, right? You don't think this is actually so bad from what you've seen?
I don't think it's a bad idea to make sure that all patients have access to some kind of health care, not necessarily having a family doctor. I think that if you improve efficiency in the system, you could offload a lot of the work that family doctors do to allied health professionals, dietitians, psychologists, social workers, et cetera, nurses, and especially nurse practitioners. So that's a good idea. And that would offload family doctors. And I think in that kind of a sense, family doctors could actually probably have more patients under their wing and spend less time doing things that are do not necessarily require their skill set.
So correct me if I'm wrong here. You sound like you're basically in agreement with the government's plan, at least from what we know of it.
Well, I mean, the plan, the government's plan is quite extensive, and there's I think 50 talking points there, and you know, from what I've read, it seems quite abstract, and it's really lip service. I mean, until the action takes place. But some of the ideas there that will free up the system in some ways, I think, are good. The payment system for doctors, however, is a terrible idea. The way that they're going to pay for the number of patients that you have. You know, not every patient is created equal, and not all MDs are created equal. We all have varying populations of patients. We have, we all work in different locations, so some patients are a lot heavier than others, for example, and to have a payment system based on the sheer number of patients you have is, in my opinion, a terrible idea.
Okay.
Dr. Cotran, could this government have done anything to make you change your mind and stay?
It's a good question. I think, this is a seed that's been planted a few years ago for me personally. I think everyone's got their own journey. If a lot of the frustrations were removed from the healthcare system the way it is today by legislation and the way that things are managed at the provincial level, I think there are good chances I would still be practicing. Yeah, absolutely. It's the fact of a million little frustrations adding up, and then when it's on a daily basis and happening hundreds of times every day, it's too much. So that was my personal experience. We all have, I think, different practices, and I think a lot of family doctors in Quebec have fulfilling practices, and they're quite happy to work in the system. And you at the end of the day, you have a relationship with your patients. I had 2,000 people who I registered under my name that I took care of, and I did my very best for them. So whatever happens outside of that relationship is not super important, but when it comes to infrastructure and interoperability of systems and things like that, those are the little annoyances that add up over time.
Now I'm curious, as you lay that out and you talk about those annoyances, the little niggling things that when you add them all up make you sit back and go, I don't want to do this anymore. What are some of those? Because I'm sure you're not the only one finding yourself in that situation. So cumulatively, those things cause you to say, I don't want to do this anymore. This is not the best use of my time. What are some of those things? And is there anything from what you've seen in this document that changes any of that?
Right. Well, at a high level, I think the document does address some. I mean, I often have patients who expect that our system works like any other app on their phone, right? They assume that I can see their entire medical history, their recent emergency department visit, the consult notes from their endocrinologist, right? But if I happen to get a fax with some handwritten information on it, then maybe I could decipher some data out of that. But otherwise, it's really back to the drawing board. And, with this lack of communication, another example is just receiving results in triplicate, quadruplicate sometimes, not receiving some results. It's a big responsibility when you order a test. I'm responsible for following up that test. If I don't get the result, it's very difficult to track down that, did the patient not go for the test? Did I just not receive it? I'm responsible if there's an abnormal result there. So a lot of systemic issues like that just, for me was sort of living in this constant fear of missing something or doing some harm, which in some cases can be dangerous.
I want to point out, I was very struck what you wrote about that patients don't necessarily want a doctor, they want care. But then I'm wondering who provides that care.
That's exactly right. I mean, I spent, I'm already talking in the past tense here, but, about 70% of my time in front of patients was spent on mental health issues, chronic care,
wow.
chronic disease management, and things like that. These are things that do not require a skill set that requires 15 years of education. This is something that can be done by people who have specialized training in counseling, for example, social workers, psychologists. And so for a family doctor to be spending such a great majority of their time on mental health, for example, we do have a role to play in mental health. We have, prescribing and follow-up and referral and all these types of things. But when you don't have the referral network, for example, a lot of the onus lands back on me. So that's an example where, allied health professionals could take care of things. So I think, at a high level, what the government's proposing in terms of having sort of a centralized system that sort of decides who you need to see, right? You feel like you need to see a doctor. Do you need to see a doctor, or do you have a, mental health problem or a foot problem, or what is your actual problem for which you're consulting today? And can we utilize other parts of the system to address that problem? I think that at least at a high level does make sense. It has to be done well, and it has to be, I think, done under the supervision of a medical team. But having that multidisciplinary approach can actually be even more effective than relying solely on, family doctors to be at the top of this, hierarchy.
So I have two questions to ask before we get out of here, because we have to wrap up. Number one, it's not every day you hear a 45-year-old doctor who's good at what he does decide to pick up and just, say, I've had enough and leave. I'm guessing, are you getting out of the profession? Are you planning to leave the province? What's the plan?
Not leaving the province. I do have a lot of children. I have 5 children. My eldest daughter is actually a family physician herself, so she'll be sort of taking over the torch. And I feel that I may be able to affect the lives of more people than I do one-on-one through education, using social media and other things. I'm very interested in artificial intelligence. I'm going to be pursuing some of my ideas in that sphere as well, and hopefully merging that in with medicine and maybe contributing to some good future for IT in healthcare in Quebec.
We certainly use it, yeah.
It sounds amazing. I was going to ask you how your patients have responded, but I'm just going to read this text that we got
They're
from
very
Angie.
sad.
Yeah, well, Angie texted in to say, Dr. Cotran was my GP the last 7 years. I was so upset when he announced he's walking away. A real loss to the system, the absolute best doctor I've ever dealt with. And then Angie wraps up by saying, best of luck to you, Dr. Cotran.
I love you, Angie.
Okay. You know, I hope we don't hear more stories like this, although I remember when we first started talking about, you know, the government deciding they wanted more doctors to see more patients, and we heard from some doctors at the time. Do you get the sense, just real quickly, that there will be other doctors who say, you know what, we've had enough, we're fed up, and are going to leave?
I think some will. I know of already a couple, unfortunately, that are even younger than I am. But I think also what's coming is, a lot of baby boomer doctors that are retiring, we're going to lose, and they have tons of patients, 3,000, 4,000, 5,000 patients. So to have new doctors come on and take, 500 to 1,000 patients, it's going to take a lot of new doctors to carry the weight. So it's just physically impossible. And I think that's why we need to look for alternative solutions to this problem.
Dr. Cotran, thank you so much for your time. Wish you, as your patient said, all the best. Thanks so much.
You're welcome.
Dr. MARC COTRAN walking away from the system. And as he said, the idea of, boomer doctors walking, they've been in practice for 20, 30 years. This guy's 45 years old.
What a loss.
And, I hope we're not going to see more of this because of this updated health plan, but we'll find out more, I guess, next week and in the coming weeks.
Like he said, and he has to prioritize, the quality of life is everything, right?
Including for doctors, no question.